Why aren't you getting enough time in your mental health visits to discuss what you need to with your psychiatrist? Dr. Sharma here, board certified psychiatrist and Air Force veteran. Something I hear from a lot of people is that they don't get enough time during their appointments with psychiatrists. This is to discuss their symptoms, medications, side effects, therapy techniques. Why is that? To understand this better, let's zoom out a little bit. There have been multiple experiments done in the past where groups of people have been given treatment in the form of acupuncture, placebo acupuncture, medication, placebo medication. And in these studies, one group will be given a treatment where the person giving the treatment is fairly neutral, maybe even a little bit cold, definitely not personable at all. In the second group, the person giving the treatment is compassionate, kind, and responsive to the participant. Guess what? The studies consistently show that in the second group, the one with the compassionate and kind practitioner, they do better in terms of their symptoms improving objectively over time when compared to the first group. This is the healing relationship between the practitioner and the patient. It's been written about many times in the past by many people, including Dr. Jerome Frank, a brilliant psychiatrist at Johns Hopkins, who in particular wrote about it beautifully. But basically, in these sessions, we as psychiatrists or practitioners have to foster a healing relationship built on trust, compassion, responsiveness to questions, and more. The issue is that our healthcare system in its current state sabotages this process. Psychiatrists are encouraged and often mandated to do very short 15-minute medication management sessions with their patients. Think about it, 15 minutes. Within that time, you have to fit in everything. This means updates in life, symptoms, medication options, choices, what to choose with medications, potential side effects of those medications, and alternative approaches. The list goes on and on. You can already tell 15 minutes is fine maybe for a patient who's doing really well, but if there are any significant concerns or questions, it's going to take a lot longer. Psychiatrists are discouraged from doing therapy because of insurance reimbursement. Insurance will pay a lot more for medication management, so clinics, companies, and hospitals want to encourage that over everything else. Want to talk to your patient about lifestyle modifications to treat symptoms? No time. Want to teach specific therapy techniques to your patient? Forget it. Want to talk to your patient about alternative treatments? Get out of here. And remember that these large clinics, companies, and hospitals are run by administrators. These are not typically physicians. Because of that, they're focused on metrics and not people. They don't think long-term about overall healthcare costs in the future and patient outcomes. For instance, you might be making a lot of money by having very short mental health visits for medication management now. But having a shorter visit, especially for a patient who has severe mental illness, it actually might result in them being admitted to the hospital, and that would incur a lot more expenses. Of course, that particular administrator or company does not have to foot that bill, so it's not really on their mind. These administrators are also not focused on preventing burnout in physicians and other medical providers. Obviously, if you have all of your psychiatrists doing these very short medication management follow-up visits, it'll increase burnout. Imagine, for instance, in an ideal schedule, the psychiatrist would be seeing between maybe 8 and 10 patients per day. But in this high efficiency schedule, they would be seeing maybe between 20 and 30 patients per day. Imagine the burnout from having to see that many people, the decision fatigue from making choices about medications and what to counsel people on, and of course needing to respond to emergency phone calls and requests, which you usually have to do at the end of the day. Again, the list goes on. This all, of course, relates back to the healing relationship that I was talking about in the beginning. Like in the experiments, when you have a practitioner who is focused on getting the visit done as soon as possible, you will not feel that compassion, that understanding, and the results will show this. To be clear, I'm not blaming the practitioner. I'm blaming the system in place. This system is solely focused on profits and not on patient outcomes. The story behind this is an even longer one and something for another video, but it's basically related to how our healthcare system was founded in the United States, health insurance, and how everything became profit-driven over time and because of policies. When I talk about all of this, I speak about it from experience. I've seen this as a practicing psychiatrist in multiple settings that I've worked in the past, and it's the main reason that caused me to leave each place, and it's the main reason that drove me to start my own practice. So imagine we're in a climate where psychiatrists are in desperate short supply, but they are being driven out of the system by the system itself. I think that this entire pattern is extremely concerning when we look at the healthcare system in general. Obviously, I've been talking about psychiatrists right now and mental health, but this also affects general medicine because in other fields, doctors have been required to see many more patients in shorter amounts of time. You can imagine that this will lead to a host of other problems on that side as well. Remember, a truly meaningful healing relationship between the physician and the patient cannot be established in this type of environment. But of course, it's hard to change because in the end, for the system, it's profits over everything. Having said that, we need to actively advocate for, develop, and promote an alternative system. I realize this is an uphill battle with our current system. And by the way, when I say system, I mean the healthcare system, but also our political system, which is mainly driven by lobbyists and money. But we can't give up. What do you guys think? Let me know your ideas and potential solutions in the comments. Dr. Sharma here. Thank you so much for watching as always. Please like, share, and subscribe. It really helps the channel. Thanks again and have a wonderful week.